Today we'll talk about the Halo Laser. This is Dr. Ron Shelton in New York City. The Halo Laser is a newer fashioned fractional laser. The Fractional Laser was one of the first fractional lasers, and that started about 15 years ago. There are many different lasers to choose from to treat sun damage, fine lines, wrinkles, sunspots, and even precancerous changes. Unlike the Fractional Laser, which was one of the first fractional lasers and does have two wavelengths in the Fractional Dual, the Halo Laser is a hybrid laser with two wavelengths, two different lasers that actually simultaneously strike the skin. Fractional Laser can use two wavelengths, but one wavelength is used and then the settings are changed and another wavelength is used. With a Halo, both wavelengths are used at the same time. The advantage of the Halo hybrid laser is that the second wavelength creates slightly open channels to allow the skin to heal faster. The first wavelength is the laser that penetrates into the dermis to stimulate new collagen growth, but that forms little channels of damaged collagen that need to come out, and the second wavelength allows that to occur faster, so there's slightly faster recovery time than the typical Fractional Laser. The Halo Laser typically causes redness and swelling, but by day 5 most people are healed, and makeup can be applied even the following day after the treatment. So we're very fortunate to have the Halo Hybrid Laser, which in addition we can perform the Shelton, which is the company, the Shelton Pro Fractional Laser with the same device. This is slightly deeper, more downtime for certain types of scars and certain types of wrinkles. I'm very fortunate to practice at the Laser and Skin Surgery Center of New York, where we have a whole host of devices and lasers, so I can customize treatment to the best of my ability for my individual patients.